You will now learn how to assess and classify a young infant. Young infants can become sick and die very quickly from a bacterial infection. They may show only non-specific signs of an infection, such as few movements, fever, low body temperature, or fast breathing. Check every sick young infant for all of the signs of a serious bacterial infection. We will now show you how to assess a young infant for possible bacterial infection. First, ask the mother
Has the young infant had convulsions?
Make sure that the young infant is calm, and then count the breaths in 1 minute. The cut-off rate for fast breathing in young infants is higher than it is for older children. A young infant aged up to 2 months has fast breathing if you count 60 breaths per minute or more. The breathing of young infants is often irregular. The young infant will occasionally stop breathing for a few seconds. This may then be followed by a period of very fast breathing. Therefore, if you count 60 breaths or more, repeat the count to see if the fast breathing is sustained. Only if the breathing rate is 60 breaths or more on the second count should you consider it to be fast breathing in a young infant. Next, look for severe chest indrawing.
Chest indrawing occurs when the effort required to breathe in is much greater than normal.
To look for chest indrawing, you must know when the child is breathing in. When the child breathes in, the upper chest and abdomen move out. Breathing in, breathing out. Breathing in, breathing out. Breathing in. This is a healthy child with normal breathing. When the child breathes in, the upper chest and abdomen move out. The lower chest also moves out. This child has chest indrawing. When the child breathes in, the upper chest and abdomen move out, as in the healthy child, but the lower chest moves in. Chest indrawing is this inward movement of the lower chest wall when the child breathes in. Look again. Breathing in, breathing out. Breathing in, breathing out. Breathing in. When the child breathes in, the upper chest and abdomen move out, while the lower chest moves in.
The lower chest wall goes in when the child breathes in. Chest indrawing is only significant if it is present all the time and definitely visible. This child is breastfeeding. If you see chest indrawing only when a child is upset or trying to feed, but not when resting peacefully, do not call it chest indrawing. This child only has chest indrawing when feeding. Therefore, we would not call it chest indrawing.
Mild chest indrawing is normal in young infants, because their chest wall is soft. It is not a sign of illness in young infants. This young infant has mild chest indrawing. However, severe chest indrawing is a sign of illness. Severe indrawing is a very deep movement and is easy to see. This young infant has severe chest indrawing. Measure temperature, or feel for fever or low body temperature. Fever is uncommon in the first 2 months of life. If a young infant has fever, this may mean the young infant has a serious bacterial infection. In addition, fever may be the only sign of a serious bacterial infection.
Young infants can also respond to infection by dropping their body temperature. If you do not have a thermometer, feel the infant's abdomen or underarm to determine if it feels hot or unusually cool.
Look at the young infant's movements. Are they less than normal? An awake young infant, such as this, will normally move his arms or legs or turn his head several times in a minute. Observe this as you do the whole assessment. This young infant has normal movements.
This young infant is moving less than normal.
It is normal for young infants to sleep most of the time. The young infant should wake to noise or if he is moved. There is no difficulty in waking this young infant. He is not lethargic. He stays awake.
If a young infant does not wake up during the assessment, flick the sole 2 to 3 times and look for the response. This young infant wakes up and remains awake. This young infant wakes up momentarily but sleeps again. He has poor response to flicking of the sole.
This is a normal umbilicus. It has no redness or pus.
This umbilicus is showing some signs of infection.
Look for skin pustules. Examine the skin on the entire body.
Skin pustules are red spots or blisters which contain pus. This young infant has many skin pustules. This completes the assessment of a young infant for possible bacterial infection